Hello everyone, I am Maitri Gauss and my topic for assignment is Shat Kriya. Shat Kriya is nothing but the stages of progression of diseases. It contains 6 stages which are Sanchay, Prakop, Prasar, Sthana, Samshay, Vyakti, Bhed. Sanchayam cha prakopam cha prasaram sthana samshrayam vyakti bhedaschayo vitti doshana sabhaveta bhishaka. Its padakshek is given below. So the first stage of षट्क्रियाकाल is Chaya. Tatra sanchitana khalu doshana stambda purna koshta pita bhasta mandoshta cha angana gauravam alasya chaya karna vivideshcheti bhavanti tatra prathama kriyakala. The padakshet and sandhi is given below. Definition of Chaya according to Ashtang Hriday. Accumulation of doshas in their own state. According to Dalhan, accumulation of doshas in the body. Features of Chaya Avastha, disliking towards the certain qualities of Vatadi doshas which are in accumulated stage. If Vata is accumulated by its Ruksha Shita Guna, then there will be disliking towards Shita and Ruksha Guna. Here there will be liking towards opposite qualities of food, like if there is Chaya of Shita Guna of Vata, the person will demand Ushna Guna more. In Vata Chaya, the person senses abdominal bulging due to Vata accumulation and then becomes lethargy. In Pitta Chaya, yellowness of nails, eyes and urine is observed. In Kapha Chaya, body temperature is lowered. The person starts developing nausea. Clinical application. Explanation. Doshas start accumulating in their natural site due to causative factors is called Chaya. Example, a person consumes excessive sweet, heavy and cold food leading to accumulation of kapha in the stomach. Symptoms, feeling of happiness, lethargy, loss of appetite. Treatment, Nidana Parivarjan, avoid sweets and cold food, Langhana, light fasting or consumption of warm water. The second stage of Shat Kriyakal is Prakopa. Kopastun margamiti lingani darshanam svesham swastasya rogas bhavah. Samas and Sandhi are given below. Doshas gets further increased and spread in the other parts of the body by leaving from their original place is known as prakopa. In such condition, the vitiated doshas manifest their abnormal symptoms and result in the occurrence of diseases. Definition of Prakopa according to Ashtang Hriday, Prakop is the movement or transfer of doshas from their site to the other parts of the body. According to Dalhan, here there is actual vilayan, that is liquefaction or leaking of doshas from their own site. Features of Prakop according to Ashtang Hriday, this stage is not only responsible for creating different pathologies in our body. According to Dalhan, this stage is nothing but vitiated state of doshas which is further responsible for creating different diseases. In Vata Prakopa, hyperperistalsis is observed, that is, food passes very rapidly through the stomach and the intestine. In Pitta Prakopa, water breath, polydipsia frequently in drinking water and burning sensation is observed. In Kapha Prakopa, the person feels nauseated about the food and heaviness in the chest is observed. Vagbhat has said that this stage doshas spread throughout the body. However, this is not quite correct. Clinical application. Explanation. Accumulated doshas get aggravated further but remain in their natural site. Example, continuous intake of kapha increasing food, dairy, fried food, etc., leads to excessive kapha in the stomach. Symptoms: nausea, dull digestion, mild mucus formation. Treatment: Dipana Pachana, use of herbs like Trikatu, light diet, warm and spicy food to balance kapha. So, the third stage of Shat Kriyakal is Prasara. Eva प्रकृपिताना प्रसरता वायुर्विमार्ग मनोटोपो औषधोष परिदाह धूमयानानि पित्तस्य आरोचक विपाक अंगसादश्चदिर्चेति श्लेष्मणो लिंगानि भवन्ति तत्र तृतीया क्रियाकाल. The Padachet and Sandhi is given below. In this stage, the doshas are hyperactivated and they leave their site and start spreading throughout the body. Prasara. Definition of Prasara according to Ashtanga Hriday: if doshas remain in increased or vitiated state, it will spread to the nearby structure as well as systems based on etiological or causative factors. According to Dalhan, doshas are moving in the whole body, that is Sarvanga Sancharan, till they find the actual place for disease manifestation. Example: Vata Prasar leads to Visarga Gamana of Vata, that is abnormal displacement of Vata in other systems or structures, along with Atopa, that is pain in abdominal region. In Vata Prasar, doshas change their place and move in any part of the body. A person experiences tympanitis. In Pitta Prasara, body temperature is raised and burning sensation is sensed. In Kapha Prasara, the person experiences fatigue, indigestion, and tastelessness. Also, a feeling of nausea is developed. Clinical application. Explanation: aggravated doshas overflow from their natural site and start spreading throughout the body. Example: aggravated kapha spread in the respiratory channels, leading to early respiratory symptoms. Symptoms: running nose, kapha, slight difficulty in breathing. Treatment: detox therapies like Vamana. Use herbs like Vasaka and Tulsi to manage the respiratory symptoms. The fourth stage of Shatkriya Kal is Stan Samshrayam. Sthana Samshrayena Krubdaha Bhavivyadhi Prabodhakam Doshaha Kurvinti Yalingam Purvarupam Taduscheti. The Padakshet and Sandhi is given below. In this stage, the aggravated doshas attack the doshas or weak tissues or waste products and disease is manifested. In this stage, the prodromal symptoms starts appearing. Definition of Sthana Samshrayam. Here there is actual pathogenesis formation, that is Samprapti Nimriti of a specific disease takes place. When the Prasara doshas, that means the doshas which are moving all over the body, when they will find empty space or evacuated space in the body, then they lodge in the particular space to manifest the pathogenesis in the body. Example: the Prasarvata dosha, when lodges in the Amashay region, lead to hampering of Agni function, further forming the pathogenesis of Jwara in the body. In this stage, the disease start progressing. The type of disease depends on where the doshas have accumulated. Depending on the type of channel, these doshas attack various diseases like diarrhea, kidney stone, fever, etc. To prevent this stage, Rasayana treatment is very beneficial. Clinical application. Explanation: the overflowing doshas localize in the weak tissues or organ, starting the disease process. Example, kapha localizes in the respiratory system causing early stage bronchitis. Symptoms, congestion, productive cough, mild fever. Treatment, strengthen Agni with herbal teas like ginger and cinnamon. Local therapies like steam inhalation or warm compressions. The fifth stage is Vyakti, stage of manifestation. In this stage, the doshas expresses itself. Here, the disease can be diagnosed early. Example: pyrexia, colitis. Sushruta has described this stage as occurrence of diseases. In this stage, proper symptoms or rupa appears. Therefore, particular disease expresses particular symptoms of Vyakti. Here, after full flourished pathogenesis, the disease fully gets manifested, especially showing the symptoms. Example, Santapa of Mana and Sharira occurs in Vyakti Avastha of Jwara. Clinical application, explanation, full manifestation of disease with clear symptoms. Example, bronchitis becomes fully established, causing persistent cough with mucus, fever, and fatigue. Symptoms, severe congestion, shortness of breath, wheezing. Treatment, palliative or detox therapies based on patient's condition, that is shaman or shodhan. Use of specific medicines like Sitapaladi Churna or Dasamula Irishta for kapha disorders. And the last stage of Kshatriya Kal is Bheda, stage of differentiation. Vatadi Lakshana Bheda Bhinnatve Bheda. The Padachit is given below. Bheda, definition of Bheda. Here the disease grow further to form certain dosha specific symptoms in the body. Vataja Jwara having symptoms of excess yoni. Pitta Jwara having daha especially in the eyes, that is burning sensation in the eyes, and Kaphaja Jwara having disliking towards food. Dalhan also considers here the formation of complication, that is upadrava of diseases. Example, Khalidya in the Jwara. Clinical application, explanation, disease progression further causes complication or chronic conditions. Example, chronic untreated bronchitis leads to bronchiectasis or COPD, chronic obstructive pulmonary disease. Symptoms, chronic cough, difficulty in breathing, chest pain. Treatment, focus on managing symptoms with rasayana therapies. Use of long-term care herbs like ashwagandha and chawanprash to boost immunity. This is the last stage of Kriya Kal. In this stage, the disease can be diagnosed correctly and its doshaja type can be decided. Example, Pittaja diarrhea, where Pitta dosha is predominant. Clinical importance of Kshatriyakal, early detection and prevention. Recognizing the initial stages allows for early intervention through dietary and lifestyle modification, prevents disease from reaching severe or chronic stages. Personalized treatment. Different stages require different treatment approaches, from simple dietary correction to detoxification therapies like Panchakarma. Understanding disease progression helps in predicting how a disease will develop if left untreated, guides physician in identifying the root cause rather than just treating symptoms. Better prognosis and management allows doctor to determine whether a disease is easily curable, difficult to cure, or incurable. Enhances the effectiveness of the treatment by targeting the disease at right stage. Thanks for watching.